to see how devastating this next Omicron wave could be. Joining us are Dr. Fahad Razak, a physician at St. Michael's Hospital in Toronto and chair of the Ontario COVID-19 Science Advisory Panel, and Michael Cohen. He's the CEO of Perth and Smiths Falls District Hospital, about 80 kilometers southwest of Ottawa. Michael, you were hoping to reopen the emergency department at the Perth building, but that didn't happen this week. Why not?
Well, we had all our plans in place, and then late on Tuesday, we got the unfortunate news that yet more of our staff had contracted COVID-19 in the community, and we were left with no choice but to delay the opening. We'll be making an announcement about that early next week.
So part of the problem here is people who are actually infected with COVID, but also I guess it's the lingering burnout from this long pandemic.
Yeah, after 2 long years of this terrible pandemic, it's been exceptionally difficult on our frontline staff and physicians. And unfortunately, in the last 18 months, we've seen quite a few people depart the hospital either for retirement or elect to go to take Monday to Friday jobs, in some cases at lower pay, just to have a bit of an easier time with their work.
And Dr. Razak, what are you seeing across the province of Ontario?
Yeah, I think that story, unfortunately, is playing out at many hospitals. The smaller hospitals are affected because of the fact that staffing is especially difficult in some of these smaller communities. But even at the larger hospitals within major urban centers like Toronto, certain parts of the hospital now are not functioning as well as they used to. For example, the inability to run an MRI suite overnight.
So what should we be taking from this? Those of us who aren't working at hospitals, but are concerned about what we're seeing here, Dr. Razak, in terms of these surging COVID infection rates that you see across Ontario, what's the takeaway for people?
So the story for Ontario with the rising rates is actually the story for Canada. We are in the midst of this BA5 wave. It has started across most of the country. And with that rise, you're going to get these infections that are cascading out, and they're going to affect the hospitals in a number of major ways. The first is that the staffing issues that Michael raised, our staff are burnt out. They're already stretched. Many departments are severely understaffed. So losing additional staff to infections is very consequential. The second is that the actual volume of patients coming in already is high relative to staffing because of the enormous backlog we've had. So if you add any additional COVID-19 admissions on top of that, many of these hospitals are going to have a very, very difficult time dealing with that volume with their existing staff shortages.
And yet, at the same time, Dr. Razak, we look around, and life almost looks like it's back to pre-pandemic normal in terms of travel and gathering at restaurants and sporting events. So, I mean, how does the general public balance what we're kind of embracing in terms of lifestyle with what we're seeing, the struggle that hospitals are dealing with?
I think there's a couple of things that have to be considered here. The first is that our hospitals are our shared, common, and critical resource. So it's not just for COVID-19 admissions, it's for heart attacks or car accidents. So even though all of us clearly want life to go back to normal, we are in the midst of a surge, not driven by lack of attempt to control this virus, but because of new mutations that are evasive and make this very difficult to control. An inability to restrict widespread spread of BA5 is going to lead to problems within our hospital sector. And this is a sector that cannot tolerate further demands.
I want to finish with a big question, and unfortunately I only have 30 seconds for each of you, but Dr. Razak, let me start with you, and that is, how do we even begin to fix this problem with these emergency rooms shutting down?
So there's the short term and the long term, and I'll keep it very brief. In the short term, we need to control the volume of spread of this virus in this wave and heading into the fall. We cannot have a large surge of patients coming in again. Our hospitals just can't tolerate it. How do we protect ourselves? Get your masking requirements out there for public spaces, get your vaccination up to date. Over the long haul, this is about staffing and resources, and that's a much bigger problem. It's about training more nurses and physicians and physiotherapists. It's about hospital capacity. We have among the lowest capacity among wealthy comparable nations. We clearly need to improve that.
And Michael, your response?
Yeah, we need a Team Ontario approach. Perth Smiths Falls District Hospital is not going to solve this one on its own, and we need to find a way to train and produce highly skilled healthcare workers as quickly as possible, and then retain them so that we can provide the care that our communities deserve.
And of course, we're focusing on Ontario, but this is a problem that's being faced by emergency departments right across the country. Thanks to both of you for speaking with us this evening.
Thank you.
Thank you, Ian.